What is burning mouth syndrome, or BMS? It's defined as a burning, painful, or itching sensation located in the oral mucosa. The tongue is the most affected part, followed by the lips and palate. The prevalence for the tongue is typically the tip, followed by the lateral borders and then the dorsum. BMS presents as a burning pain in the oral mucous membranes, occurring in association with normal signs and normal laboratory findings. What brings a patient to your clinic with BMS? The chief complaint is usually burning. Patients may suffer primarily from burning alone, burning and pain, or burning and numbness. Additionally, patients may or may not suffer secondarily from a dry mouth, dry lips, or a persistent metallic taste. BMS can be subclassified into primary or idiopathic BMS, where a neuropathological cause is likely and cannot be attributed to any systemic or local cause. On the other hand, secondary oral and perioral burning sensation as a result of local or systemic factors or diseases is classified as secondary BMS. BMS is also known by several other names: glossodynia, glossoporosis, stomatodynia, stomatoporosis, sore tongue, and oral dysesthesia. Etiology of secondary burning mouth syndrome. Local factors and diseases known to induce secondary BMS include oral candidiasis, lichen planus, and allergies. Systemic disorders that induce secondary BMS encompass hormonal changes, deficiencies of vitamin B12, folic acid or iron, diabetes mellitus, side effects of medications, autoimmune diseases, and salivary gland disorders such as Sjogren's syndrome, fibromyalgia, radiation, stress, and anxiety. Local factors inducing secondary burning mouth syndrome. Denture problems can play a role, including ill-fitting dentures, interincisal space and vertical dimension issues, residual monomer, allergies, and unpolished rough surfaces. Conditions like median rhomboid glossitis, geographic tongue, and fissured tongue are also contributors. Hypersensitivity to food or dental materials such as CMCP is another factor. Lichen planus is a chronic inflammatory mucocutaneous disease mostly seen in middle-aged individuals. It appears as bilateral white lesions with considerable variation in its clinical appearance, affecting both the oral mucosa and skin. This condition can significantly affect the quality of life in affected patients. Moreover, malignant transformation in patients with long-standing oral lichen planus has been documented. Nerve disturbances or damage, known as neuropathy, can also induce secondary BMS. This can either be centrally affecting, like in multiple sclerosis, or peripherally located, such as lesions like cysts, tumors, or compression by an artery or vein. The prolonged use of chlorhexidine gluconate mouthwash can contribute as well. Other factors include oral habits like tongue thrusting, oral carcinoma, and complications of radiation therapy, including dry mouth and difficulty swallowing in late stages. Systemic factors inducing secondary burning mouth syndrome. Sjogren's syndrome is one of the most common chronic autoimmune disorders, characterized by dry mouth and dry eyes. There are two main forms of the disease: primary and secondary. Primary Sjogren's syndrome, also known as Sika syndrome, consists of dry mouth and dry eyes in the absence of any other connective tissue disorder. Secondary Sjogren's syndrome is the combination of dry eyes, dry mouth, and a connective tissue disorder such as rheumatoid arthritis. There is a female-to-male ratio of about 9:1, with most patients being middle-aged or elderly. Candidal infections are very common and lead to redness, glazing, and soreness of the oral mucosa. Xerostomia, or dry mouth, presents with symptoms like generalized oral discomfort, sometimes described as burning, difficulty in talking or swallowing, altered taste, failing dental restorations, and poor retention of dentures if worn. It's important not to confuse xerostomia with burning mouth syndrome, in which salivary production is normal. Diabetes mellitus is another systemic factor. Peripheral neuropathy is common, where Schwann cells absorb water and swell, putting pressure on the nerve. Electrolyte imbalance due to polyuria can lead to dehydration and xerostomia. Insulin-related catabolism decreases resistance to trauma, and diabetes is usually associated with candida infection. Altered chemical composition of blood reduces chemotactic and phagocytic functions, lowering immunity. Vascular changes like atherosclerosis result in a lower pain threshold. The use of broad-spectrum antibiotics can alter the oral microflora. Gastroesophageal reflux due to a weak cardiac sphincter can clinically appear as teeth erosion and is treated with antacids and proton pump inhibitors. Vitamin B complex deficiency will lead to burning mouth sensation. In mild cases, symptoms of a vitamin B6 deficiency include sores on the tongue, irritability, and depression. Vitamin B6 plays a role in neurological, endocrine, and immunologic disorders such as hypothyroidism. Psychological problems such as depression, anxiety, and cancer phobia can also induce secondary VMS. Cancer therapy, including irradiation, nutritional deficiencies, and certain medications like ACE inhibitors and captopril, are additional factors.